Greetings and welcome to this week's COVID Chats and Facts, sponsored by the UAMS Division for Diversity, Equity, and Inclusion. Today, we have a very special show for you. First, we have a co-host, a very special co-host today, our very own Dr. Brian Gittens, the UAMS Vice Chancellor for Diversity, Equity, and Inclusion. And here today to talk about politics, protesting, and all, we have members of our very own Arkansas General Assembly, Senator Linda Chesterfield and Representative Jamie Scott. So let's jump right into this fun conversation. But first, let me kick the show over to my favorite guest co-host, Dr. Brian Gittens.
Outstanding. Thank you, Amber. I would have missed this show for anything. I'm really excited to have our guests here today to talk about COVID, politics, social justice here in the Central Arkansas area. So I know that I'm co-hosting, but I'll be here for the ride as well.
Thank you. And let's start with you, Representative Jamie Scott. Thank you so much for being here with us today.
Absolutely.
So please tell us all about you.
Me. Okay. My name is Jamie Scott. I represent House District 37 in North Little Rock, and that's some of Maumelle, Jacksonville, Dixie, it's a big area. It's a very big district. This is my first term. I'm the youngest African-American female ever elected to the Arkansas General Assembly.
Yay! And Black girl magic.
It's a blessing to just represent my people and represent a district that I've grown up and lived in my whole entire life. So a lot of my constituents, they're like my high school classmates' parents. Like, I know these people, so the policies and the bills that I put forth impact everyday people that I know. And so it's a blessing, and I enjoy it.
Okay. And speaking of everyday people that you get to impact and all that you do, and do it so well, when did you have that moment where you just knew politics is for you? This is what you wanted to do with your life.
Well, I started, the first campaign I ever worked on was Hillary Clinton when she ran for president. So I learned in a very intense battleground states. I went to Iowa, Ohio, Pennsylvania, Indiana, anywhere you can think of, campaigning for her. But I was so, but once I got off the campaign trail for Hillary, I moved back home and I started my own consulting company, because I just wanted to be the person that made the decisions. I saw how to do this work, prayed about it with my family, and I just took a leap of faith. And so for so many years, I just was consulting on so many races. And what I loved about being a business owner is I only took on races for candidates that I believed in. But I somehow met Senator Joyce Elliott, and she completely just changed the trajectory of my life, that one chance encounter, because her mentorship has been very invaluable in the things I've been able to do. She sent me to this conference, her and this group of women, to DC, called Women at the Table of Powers. And it was really cool, but I met women from all over the world who were elected. So this one woman I met from Iran, she told me, she was like, Jamie, in my country, the life expectancy for women is like 40. And she said, women also in my country that are actually like serving as elected officials like I am, she said, they make detours to get to the Capitol. She's like, when I leave my house every day, I hug my husband and my daughter because I don't know if I'm gonna make it home. And she said they do detours just to get to the Capitol to vote for issues like education, women's rights. I live like 7 minutes away from the Capitol. So I was like, you know what? She's right. And she was like, there's no reason your name shouldn't be elected. And that's when I decided to run.
Thank you. And Senator Chesterfield, will you please tell us more about who you are and who you represent and all about it?
I'm Linda Pondexter Chesterfield. I represent Senate District 30, which encompasses the area between Jacksonville and the Jefferson County line. My district is like a big hump on the back of Pulaski County. I have what I'd like to say the most eclectic district in the county, in that I represent very, very small communities like Dick Jeter and Wrightsville and Higgins and Woodson, but I also represent the major cities in this area. I represent portions of Jacksonville, Sherwood, Maumelle, North Little Rock, and Wrightsville are the incorporated areas, and all points in between. I am moving into my last term in the Senate. I served 3 terms in the House, and I am in my last term in the Arkansas State Senate. I'm just a little country girl from Hope, Arkansas, who saw the need for service, and am so enthused about healthcare because having been asthmatic as a kid and having to drink cow chip tea and turpentine on candy and all of that, it's good to know that we are trying to move apace with giving good quality health care. I made it through all of those horrible things, and here I am today.
Thank you. And speaking about what you're passionate about, when did you have that aha moment, that moment where you just knew politics is for you and this is what you wanted to do with your life?
I have been engaged in politics since I was in junior high school, running for president of something. I never ran for vice president. I always ran for president of something because I thought that if I were in the position to lead, then I could help set my own agenda. And I keep telling young people, you don't want to be at the table, you want to set the table. And that may sound a little bit egoistic, but I believe if we are not the ones who are deciding what the menu will be, others will decide the menu for us. So I believe that we ought to set the table, not just be at the table.
And what projects are you currently working on? What policy change? What would you like to see happen in the future?
One of the things I'm most interested in, of course, children, because I was an educator for some 30 years. And going into this next session, there are a few committees that the minority can chair, and I'm seriously considering chairing children and youth because I have worked so hard for children who are incarcerated so that they get a quality public education. While the Black Caucus was talking to the Department of Health, one of my major concerns was we are not testing those children who are incarcerated. And we were told that's because they weren't symptomatic. Well, guess what? They have symptoms now. We have a number of kids at the Ajax Center in Alexander and Harrisburg who have tested positive. I'm also concerned about making sure that those young people who are incarcerated get a quality education. And so I have pushed to include Shorter College in providing those young people at AJAC or the Arkansas Juvenile Assessment Treatment Center to be able to get started with their college education if they finished high school. We put into place during my tenure there a program of study that will allow them to get a GED or a high school diploma. Because if we are not providing them with the educational opportunities, then they will become repeat offenders. So that is a part of where my heart lies as we speak.
Representative Scott, first of all, I want to say thank you and I appreciate your support in terms of supporting DDI summer programs. And I know that children are near and dear to your heart. Can you tell me some other policy sort of areas that you're passionate about?
Besides kids, I'm passionate about criminal justice reform, juvenile justice reform, getting real interested about policy regarding health issues. I guess because of the pandemic, you're forced to, as an African-American elected official, look at the inequities and the disparities in healthcare system. I'm really just, as a freshman, there's so many issues that you have to learn about. I'm constantly reading. During session, we're reading hundreds of pages, just trying to understand bills and where I feel like I can be better, well-versed on the issue. So I'm really interested in a lot of different things, honestly.
Sure. And I know that you were a big advocate of during the pandemic in terms of looking at that prison population and incarcerated people there and getting early releases for those to help to mitigate some of that issue. When you think about going forward, what's currently on your docket, what are you working on?
Well, I'm working on a bill, hopefully with our commissioner, Johnny Key, about banning, I think I shared with you a video about a student that went viral, a chokehold by a student resource officer. And so I'm looking at criminal justice reform. I'm going to be on a panel with the prison system in a couple weeks. I'm looking at some bipartisan legislation in regards to criminal justice reform, but I'm also looking at what are some ways to address ACEs, adverse childhood experiences and trauma. I think we got to do a better job of this pandemic. You know, we don't know what kind of impact it's going to have on kids, what impact it's already having on their parents. And so at work, we're already trying to just have conversations about social and emotional wellness for the parents, giving them an avenue to talk to therapists about, because right now we're seeing that African Americans, especially women, are being furloughed and laid off more in this pandemic than anybody else. We've also seen, I'm thinking the unemployment rate has impacted African Americans and Hispanics. I think the percentage that I saw the Labor Department release was like 16 to 19% compared to white Americans who are at 14%. So I'm a big person on data, numbers. I want to understand a lot of things. So I'm always just trying to make sure I can find common ground so that I can put forth the best policy for Arkansans.
Sure, I think that's absolutely right. A lot of people try to separate health from some of these ACEs and other social determinants of health, but recognizing that, and I love the way Dr. Patterson at UAMS sort of framed it, this is a public health issue. Okay, when we start talking about discrimination, we start talking about adverse impact with regard to employment, nutrition, and our children. Okay, it becomes a public health concern. You either pay now or we're going to pay later for those things.
Oh, absolutely.
So I appreciate that. Thank you so much for your work and all that you do.
No, thank you. And we're excited to have UAMS. I mean, just in the state. I don't know where we would be right now without UAMS leading the charge during the midst of this pandemic.
Absolutely.
I'm sure Senator will talk about.
So this is really a question, and look forward to your feedback for both Representative Scott and Senator Chesterfield. Obviously, you've seen during the Arkansas Department of Health reportings the disparity with regard to our communities. When I talk about the African American community as well as the Latinx community, oftentimes they're on the face of they're forward facing with regard to this pandemic, because they're oftentimes working these service jobs and things like that where they're exposed to the public and they don't have that latitude to work from home and things like that. So what's some of the messaging that you have for your constituents as you talk to them about wearing masks, social distancing, and being safe? So what's the messaging you have for your constituents?
If you don't, it could kill you. I have found that if you keep it real with people, then they have a tendency to listen to you. I could talk about the statistics, but I'm trying to instill in them, this is killing Black people like it's the right thing to do. It's killing brown people and poor people like it's the right thing to do. And if we don't take care of ourselves, nobody else is going to take care of us. And I'm afraid one of the reasons that we have a cavalier attitude toward this, or a more cavalier attitude than I think we should, is because they have come to realize that people of color are being disproportionately impacted. And so it doesn't seem to mean quite as much if Black and brown lives and Marsha Lee's lives are lost, or even poor whites are lost. It's not me. And if it's not me, then it doesn't matter. Well, it matters, because where I am, there you will be also.
I absolutely agree. Representative Scott.
I think messaging is so important, and Senator Chesterfield does an amazing job at that. I just try to follow her lead. She's on the radio, she's doing interviews everywhere, but I think we're also seeing that African Americans are impacted at a greater risk because they are oftentimes in jobs that allow them more continual risk to exposure. So they're on the front lines in our grocery stores and transportation, nurses, whatever it might be. They don't have the luxury, to work from home like some of our other counterparts do. So it's important that they get tested. And so yesterday, that's why Senator Chesterfield and I, we've been working really hard and just trying to advocate for more testing in North Little Rock, because for some reason, African Americans initially didn't think that they could get the disease. And we were telling them that's absolutely not true. Sure. You should go get tested. It's our responsibility to protect our loved ones and our neighbors. And so that's why we're we're trying to lead by example, if that makes sense.
I appreciate that. I think the national narrative hasn't helped much, right? Because there was some studies that were done early in this pandemic about African Americans being at lower risk. I think that didn't help. And then there was the confusion that came out of the CDC with regard to mask or no mask.
Mhm.
I'm sure that didn't help as well. But I still struggle with as I go around to the supermarkets and outlet stores and department stores and the like, and I see us, African Americans, young African Americans, oftentimes either not wearing a mask or wearing a mask incorrectly. So, what's the messaging to that? How do we get people to change their behavior and really embrace this pandemic as something deadly, as Senator Chesterfield mentioned?
I'm not really sure. I really wish I had a bulletproof answer for that. I keep just preaching the word, in season and out of season. I know several of our pastors were going to continue to have church. And we got on the phone because of the relationship that Representative Scott and I have developed with the faith-based community. We were able to talk to them as others were not able to talk to them.
Mhm.
You have to have relationships that are built over the years.
Yeah.
And when you build them over the years, people are more inclined to believe you. So when I got on the phone with several of my pastors who were still having church when it was beginning, we thought to peak. We were able to convince them, let's discontinue meeting in mass, and even that smaller step, I think, was helpful.
Sure.
And visiting with them, because some of them have pre-existing conditions. Now I've got one of them that I talked to who's riding around with his Lysol all of the time. It's just one step at a time. You can't get everybody, but you try to talk to young people, you try to talk to senior citizens, you try to talk to the faith-based community, and try to make them aware, because they're the leaders in this community still. And unless you are practicing good health, then nobody else is going to be able to do that.
Sure. Modeling that behavior is absolutely fair, as Representative Scott mentioned earlier. What are your thoughts?
Well, I'm a millennial, and so I only mention that because, we have all these protests that are taking place as well. And so Senator Chesterfield spoke at one of the, the rallies that they had at the Capitol, and I've attended several of them. And, as you were just saying, the young people are out there, they're upset with stuff that's going on, as they should be. And, they're protesting, and they're out there without masks. And it grieves my heart because me and Senator Chesterfield talk about it all the time. Them going back home to their families. Like, a lot of African Americans are multi-generational families. And so, when you're living at home with grandmother and mother, you risk exposing somebody who has a pre-existing condition. And so Black people, African Americans are just, right now in the country, they're in a hard spot. They want to protest for the things that they care about. And they're also, dealing with the pandemic. But, I'm encouraging young people, if you're out there protesting, go get tested.
Sure,
I'm not going to tell you to not protest, because I'm out there protesting with them. But please go be responsible. Please wear a mask when you're out here. Please practice social distancing. So.
Right.
They laughed at me, when we first went into the special. They just thought I was hilarious. I had gloves, I had masks on. They were like, now everybody's wearing masks. Because I am asthmatic, I'm old, and I don't want to die.
Right.
But now I've got all these folks with these cute masks on. We're trying to make it, if we can make it a fashion statement for young people, whatever it takes to make it operate better, that's what we've got to do. But they were really tickled. You see how she's laughing. But I still wear my mask and I wear my gloves.
There you go. You were certainly leading the way on that.
That's
so
right.
I'm going to turn it back over to our host, Amber.
Yes, thank you so much, all of you. We will be back after these messages, more conversation to come. So please come back to COVID Chats and Facts, and we will speak with you in a moment. Welcome back to this week's COVID Chats and Facts. We have a special show if you missed the first half. We are here with our co-host today, Dr. Brian Gittens, the UAMS Vice Chancellor for Diversity, Equity, and Inclusion. We have Representative Jamie Scott and Senator Linda Chesterfield with us today, and we are talking about politics during the pandemic. What should our communities be looking to our Black legislators for at this time? What is the role of Black legislators during this pandemic?
one of the things that the Arkansas Legislative Black Caucus has done is use our bully pulpit to get conversations with the Department of Health, the governor's office, so that we make sure they understand what is needed. Especially, we are concerned about in the Department of Community Corrections or the Department of Corrections, the fact that we have so many people who are infected. And we were demanding that these people who were on the verge of being let out be let out. Everything we do is not on television or on radio. Many times it's just behind the scenes and us using the bully pulpit that comes with the position to say, these are the things that are troubling us, and these are the things that we would like you to do. Fortunately, the governor has listened to us because we have not misled him. We have been honest with him. He has been honest with us. We can't get everything we want, but he has been very, very helpful during this particular period in listening to what we have to say, getting the testing. Everybody just can't call and say, we want testing in this community, but we can use our voices to say we want testing in our various communities. And we represent so many because there are only 13 of us. Is that right, Jamie?
13 or 14.
13 or 14 of us. And we have to represent the poor, Blacks, brown people across the state of Arkansas. So we are using that bully pulpit both in public and behind the scenes to make a difference for those people.
Outstanding. Representative Scott?
I agree with everything the senator said. I think I think early on when we had issues with the messaging specifically for African American communities revolving COVID, you know, like Senator Chesterfield say, we have developed a relationship with the governor and his staff, and we were able to talk to them so that he and ourselves could be better messengers to the minority community, because the messaging just wasn't there, if that makes sense. And so you have to have those relationships to where people, you know, I don't think we would have got that done by just on social media dragging the governor. You know, we have to be respectful in the things that we need done, because we can't do any of this on our own, if that makes sense.
Okay.
We also pushed for a minority vendor to provide ads, informational ads. It's a small one, and we would be great if UAMS pitched in and helped this person get this message out.
Sure.
Because he's very good at what he does, he and his company. But we wanted to have a voice in the minority community on Black radio across the state, using those social platforms that the governor's office does not use. I believe that if our young people can get thousands of young people to show up using certain platforms, and this person knows them, then let's use that voice. So we've been pushing for minority vendors to help us get the word out, so that it's not really effective if it's just the governor and the first lady. That doesn't appeal to us. We've got to speak to us in a language we understand.
Absolutely. I think the use of and leverage of influencers is very, very important, because people, different populations are influenced by different people, or different messaging would resonate, or even the platforms, as you mentioned, social media and the like. So, but as we think about now, where we are right now, we are, seems like we're having sort of a resurgence of the pandemic, and what can we do? What can we do collectively? And I'm really thinking about the Black Caucus, and I'm going to parlay that into the question with regard to DDEI. So I enjoyed partnering with Black Caucus. I look forward to doing more work with them. But what would that look like in terms of UAMS, the Division of Diversity, Equity, Inclusion, and the Legislative Black Caucus in this time of need? I'd like to get some ideas.
Well, I'd love to see us have a collaborative effort. Or am I unmuted? I'd like to see us have a collective effort among all of the fraternities and sororities and the links. And let's collectively say we are going to do an outreach to better educate people about healthcare.
Sure.
To get them registered to vote.
Sure.
Starting October 19th. And also to make sure that they have what they need in order to get people signed up for this census. And those three are inextricably intertwined to me, because as we vote, we impact healthcare. As we vote, we also determine, or as we fill out the census, we determine what amount of money is going to come into this state to impact healthcare. And we were 31% missing in the last census. 31% of the money was left on the table in Arkansas because only 69% of the people filled out the census. We could have used that money during this pandemic. We could have used that money at UAMS. We could have used that money in our education system. And so we've got to talk about those three things because I think all of them are inextricably intertwined, and then bring the collective voice of those sororities and fraternities and service groups, and then the faith-based community. If we were not in a pandemic, we would have called meetings, because Jamie and I are notorious for calling meetings of pastors. You know, we get them together, we feed them, and then they listen to us.
Sure.
We have found we don't have to feed them anymore. They just listen to us anyway. They know it's easier to listen to us, but I see that collective voice making such a huge difference, and we have so much power that we don't know about.
Sure, and I would probably add AMDPA, the Arkansas Dental and Pharmaceutical Association, to that as well, that network
and
of
the Black
physicians,
mayors,
right, that we have across Arkansas. I like that idea of that kind of coalition, if you will, coming together to solve problems that impact our people. And I can say on behalf of the Division of Diversity, Equity, and Inclusion, we are willing partners in that as well.
Oh, wonderful.
All right. Representative Scott, what are your thoughts?
Well, I like the idea that Senator Chesterfield and I were talking about doing another testing site for COVID, but we're talking about doing it in partnership with New Hope, UAMS, and a back to school drive, because, you know, right now we have a lot of parents that are concerned about, you know, what back to school looks like for them. And so I think Senator Chesterfield, is that the first week of August we're trying to get that?
Yeah, and we're also trying to get the testing for our HBCUs, because we don't have money that would allow that to happen. So we want them to be testing their kids before they come in school.
I heard about that partnership with Walgreens to conduct that testing for the HBCUs. So that's a very exciting initiative. But I didn't mean to cut you off, Representative Scott.
Oh, no.
We do that to each other. I'm sorry.
No, you're fine. No, I think collaboratively, we just have to do things, because we have areas in our district, like yesterday, I guess the COVID testing that we did. Senator Chesterfield, do you think we turned away maybe 200 people?
At least.
We probably turned away at least 200. And so what we know of...
Will you tell us a little bit about yesterday's testing? Like, where was that one?
We were at Short College. Go ahead, Debbie.
I want you to go.
Oh, no. We were at Shorter College. They asked us on Thursday, as I said, this past Thursday, we set it up. Well, don't ask us to do stuff if you don't really want it done. We pride ourselves on getting things done. So Jamie did the outreach to the faith-based community. We were on radio. Called Broadway Joe Monday morning, said, can I be on the show? Tuesday morning, Broadway said yes. It's those relationships in the community that have allowed us. And people said, oh, Senator Chesterfield, I heard you this morning, so I came out. There were people that were there at 10:30 a.m. It was supposed to start at 10 and couldn't get tested because people started coming at 7:30 a.m.
Yes.
Right after I got off the radio with Joe, people started showing up.
So it sounds like we need to come back out there.
Absolutely.
So
because people were really hot with us.
Yeah, but let's talk offline about how we can make that happen. Okay. All right. So, Amber.
Thank you. So you were saying more testing sites, Representative Scott, in that area and other areas. Are there any other ways, like through other organizations, that you'd like to see join that cause, like the coalition effect that we were talking about?
No, absolutely. I think going forth, I'm going to bring in a whole lot of more partners because we're all in this together, if that makes sense. And the more messengers we have on this issue, it can't just be Black elected officials. We asked our community leaders and our faith leaders to come out and get tested because we want to encourage them as you're trying to open up your churches. You need to know your status. You know, people in your church need to know, are they positive? Do they need to be self-quarantining? And so I think it's just us continuing to be on the forefront and push these issues and make sure, because the people in our district, Senator Chesterfield and I know, they're not going to go to UAMS and get tested, no matter how much we tell them, go get tested. You know, we have to bring, that's why you have outreach. That's why outreach is important. You have to bring the resources to the underrepresented, underserved communities. And so that's our job to do that. And we're on it, if that makes sense. And so we look forward to partnering with y'all too.
Sure.
Well, we
Absolutely.
were excited because I'm trying to get it in the South End now in Little Rock,
All right.
representing all parts of this county. I don't know if we've tested in Jacksonville. If we haven't, we need to.
Okay.
I know we haven't tested in the South End in Little Rock or the East End. We need to go back to North Little Rock, and
Sure.
I find myself running, trying to deal with Representative Ed on this side of the river and Representative Scott on the other side of the river. But it energizes me
Absolutely.
because if you can help somebody, my grandmother always said, if you can help somebody as you travel along, then your living will not be in vain. That is what pushes me.
Well, I certainly appreciate us chatting today. And as always, I try to be that bridge between the community and Legislative Black Caucus and UAMS, so you don't have to feel like you have to navigate the system yourself. So feel free to call on me, and I'll do what I can to ensure that our community gets what they need.
Sounds good.
And before we get out of here today, I have a question for our co-host who has assisted with today's show. Do you have anything that you'd like to share with the community about UAMS Division for Diversity, Equity, and Inclusion? Anything about that you would want the same community that you're fighting for every day to know?
Well, I want people to know that UAMS, the Chancellor and myself and all the senior leadership, they have a profound commitment to diversity, equity, and inclusion. And that includes ensuring that we have equitable access to quality care for our patients. We're in the process of building a statewide system, a network. Really, I think before we've been sort of Little Rock and Central Arkansas focused, but it really is looking throughout the state and ensuring that that occurs. In terms of my particular role, again, I like to be that bridge and that conduit, that connector between assessing the needs of the community and bringing it back to the DDI and keeping that on the agenda here. So that's my golden plan. That's not just in Central Arkansas, but throughout the whole state. So I take that job seriously and then wake up every morning with that in mind.
Thank you so much. I want to thank all of you for being here today.
Thank you.
All right.
Thank you.
Thanks so much. All right.
Thank you so much to my favorite co-host or guest co-host, the Vice Chancellor for Diversity, Equity, and Inclusion, Dr. Brian Gittens, i.e. my boss, as well as the two amazing women from Arkansas's General Assembly, Senator Linda Chesterfield and Representative Jamie Scott. We thank you so much for being here today. We really appreciate all the wisdom that you have given us. We also want everyone to remember that if you have a fever, cough, shortness of breath, do not come directly to the doctor's office, that is at UAMS, or to an emergency care clinic or an emergency room. You can call. You can also try a drive-through screening. So UAMS has drive-through screening at Chesterfield and Jack Stevens Drive in Little Rock, Arkansas. That phone number is 800-632-4502. Again, that's 800-632-4502. You are welcome to call and get information ahead of time. You want to make sure that we are being safe, make sure we're wearing masks, washing our hands, because it's going to take all of us, each and every one of us, to get through this. So please join us next Friday for COVID Chats and Facts. As always, I am your favorite diversity specialist, Amber Booth-McCoy. This is brought to you by the UAMS Division for Diversity, Equity, and Inclusion. We thank you so much for listening to us today, and we'll see you next week.